So we just saw some representations of pericardial tamponade in each window that we discussed before. Here's another picture of a patient in significant respiratory distress with a different pathology underneath it all. So here's your long axis view again. Notice your descending aorta and your large pleural effusion here next to the descending aorta. Here's a short axis view. Notice that left ventricle right in the middle of your screen. Squeezing right at the beginning of your image, you can see this large pleural effusion down here, external to that bright white pericardium. So you may confuse that with with a large pericardial effusion, but if you know that this bright white pericardium is actually internal to that dark substance, you know that the fluid is actually outside. Lastly, here's an apical 4 view. Notice again, right at the beginning of your image or your video, there's a large black anechoic collection adjacent to the heart. This serves here as a large left-sided pleural effusion adjacent to this left ventricle. Again, pericardium is this bright white substance here, not involved, internal to this dark echo over here on the right at the beginning on the right side of your screen. So just don't get confused by that. Those are actually much, much more common than a pericardial effusion. You'll see these quite often when you have patients with heart failure or malignant lung disease. Tamponade we discussed quickly. I won't dwell on this, but here are some data points for you. Notice the RA collapse is very sensitive, somewhat specific for tamponade. And there's your RV collapse and IVC dilation being another surrogate, which again by itself extremely sensitive but not very specific because a lot of other things can cause IVC dilation other than tamponade. How about using them in combination? This is where you probably should be doing it. If you see RA collapse or RV collapse, look at the IVC. If either of those, or if the IVC is very dilated and you're seeing either of those go on, RA collapse or RV collapse, look at the likelihood ratios greater than 15, which is quite significant. So it lends itself to just make sure you look at the IVC in conjunction to looking at the heart if you're thinking about tamponade. Thanks for bearing with that. We're going to move on to the EFAST module. So I'll stop this for a moment.